I'm Dr. Erin Michos. I'm an associate professor in cardiology who specializes in women's cardiovascular health and cardiobstetrics. Cardiobstetrics is the field that focuses on the intersection of pregnancy, both normal and abnormal pregnancies, and heart health. And so this relates to both providing guidance to women who have underlying cardiovascular disease to help them have a safer pregnancy, but also for women who might not have known to have cardiovascular disease prior to the start of pregnancy, understanding the impact of adverse pregnancy outcomes on long-term maternal cardiovascular risk. So I'm going to give 2 talks at the American Heart Association 2021 scientific sessions related to this topic. My first talk was about preeclampsia, but first I just want to highlight the impact that maternal mortality is rising in the United States, and it disproportionately affects Black women and American Indian, Alaska Native women who are 2 to 3 times more likely to die from pregnancy complication than white women. And we're having this talk at the American Heart Association meeting because cardiovascular disease remains the leading cause of death and maternal mortality. And we think that 3 out of 5 of pregnancy-related deaths could be preventable. So my first talk is about preeclampsia. Preeclampsia affects 5 to 8% of pregnancies, and it's a pregnancy complication associated with high blood pressure and evidence of organ damage, usually to the kidney or the liver, that emerges after 20 weeks of gestation. This can occur in women who previously had a normal blood pressure, but it also can be superposed on women who had chronic hypertension prior to pregnancy, which remains a high risk factor. And we know that preeclampsia is associated with both acute cardiovascular complications at the time of delivery. We published on this recently in the journal Hypertension, which is an AHA journal, about the increased risk of short-term complications of heart failure and peripartum cardiomyopathy. But it's also now well recognized that these cardiovascular risks extend many, many years beyond pregnancy, even to later in life. That these risks, even a decade or more after the index pregnancy, that women with a history of a preeclamptic pregnancy are about 2-fold increased risk of having a future cardiovascular event, such as a heart attack or a stroke, and they're 4-fold increased risk of having heart failure. And so there's a lot of opportunities for clinicians to implement prevention to reduce this elevated risk. In the short term, for women who are pregnant and having a pregnancy associated with preeclampsia, after delivery, there's an emergence of postpartum transitional clinics, preeclampsia clinics, that we call this the 4th trimester care, where we help transition these women into longer term primary care. We really want to make sure that they get their blood pressure checked post-delivery. And it can be hard for women who just delivered and have an infant at home to go to follow-up visits. And so there's been a lot of interest in using things like apps and home blood pressure monitoring to help engage women to be active in their own blood pressure management care and patient-centered lifestyle interventions. But even longer term, I want to have a plea for clinicians to take a comprehensive reproductive history to ask women about their prior pregnancies. Women remember their pregnancies very well, and we just need to ask them because we'll identify women at higher risk that may not be reflected by their traditional risk factors. And although I'm talking about preeclampsia in this talk, we also know that the adverse pregnancy outcomes of gestational diabetes, preterm delivery, small for gestational age, infant also is associated with increased risk. So, why is preeclampsia and vascular disease, related? What is the chicken versus the egg? Well, it's thought that preeclampsia and vascular disease share a lot of mechanisms in common. There's a lot of shared risk factors that can lead to endothelial dysfunction. But it's also thought that maybe preeclampsia directly confers increased cardiovascular risk in a causal fashion, such as the inflammatory and thrombotic milieu of preeclamptic pregnancy, the sensitivity to certain hormones like angiotensin II may further propagate endothelial and vascular damage that sets these women up for later life cardiovascular risk. And so in this talk, I was specifically talking about preeclampsia, but it's important to note that there's other adverse pregnancy outcomes, such as gestational diabetes, preterm delivery, small for gestational age, infants is also associated with cardiovascular risk.